more. And thank you so much for joining us today. All right, just a little bit more. Thank you so much all for taking the time out of your day to join us and chat about planning for the new normal for and especially with our community. So we're really happy here at Bromley by Bow to kind of have this session with you all today. And some of you may have already attended some of our reminder. I'm Berenice, I'm heading the program, the Knowledge Share and Exchange program at Bromley by Bow, and I'm currently running this series of webinars. As usual, if you could all kind of ask your questions and introduce yourselves in the chat box, that would be awesome. Keep yourself on mute at all times. I think you can't unmute yourself anyway. And so, yeah, just to avoid some background noise and things like that, because there's quite a bit of, quite many of us on here today. And a recording will be available after the webinar, so that will be sent to you via email just a few days after the webinar. If there's any problem as well, anything, if you can't hear anything like that, please just let me know via the chat section as well, and we can kind of sort it. So in terms of today's agenda, so like you probably know already, we're discussing how we're going to plan for the new normal and how we're going to, especially like one of the big questions was what is the new normal going to look like? And I think the important part of today's discussion is that we acknowledge that you know, it's for us with our communities to shape this new normal and decide what it's going to look like. It's all very unsure at the moment, but at the end of the day, it's for us to see and decide what we're going to make the future. This is also an opportunity to kind of make sure we adapt to the current situation and adapt to our communities better and work with them, yeah, to support healthier and healthier lives and better well-being. So today we're going to be kind of looking at different topics. So, you know, how we can make sure that what we learned during the crisis is not forgotten and kind of helps us improve community services in the future. I'm going to have a look at how we can make long-term changes to the way we engage with community members and support them, what is necessary to measure the impact of how we have all adapted our services during the lockdown, how we can all involve everyone, how we can involve everyone in the process of shaping our new common normal and support communities to take things forward themselves as well. And by merging all the new practices, what needs to be put into place to go back to face-to-face service delivery. So today with me, I have 3 colleagues from Bromley by Bow who are gonna do some short presentations about what we've been doing and what are our thoughts about kind of planning this new normal we've all been talking about. So we'll have some 15 minutes of case studies. So first of all, Catherine Tollington, our Executive Director at Bromley by Bow, will be talking about how we've been planning to reopen our facilities safely and starting face-to-face delivery again. So she'll be explaining for a few minutes about what we've been doing at Bromley by Bow. Then we'll have Jess Walker, who's Communities Driving Change Project Manager. She'll be talking about to us about how to involve community members within the change process. And then finally, my colleague Dan Hopewell, who is Director of Knowledge and Innovation at Bromley by Bow, will also be talking about how we've been learning from the crisis and how we can enable long-term change. Then we'll have some short Q&A with our panelists, so prepare questions and things like that. And then we'll have some breakout discussions in groups of 5. Hopefully we can do 5, and kind of discussion as well. So that will be the program for today. And now I'll hand over to Catherine to talk to us about what we've been doing and the work the committee has been doing in the last few months.
Well, hello everybody, and a very warm welcome to this. I don't know which number of this webinar is in our series, but it's lovely to see you all. First of all, I don't have a presentation. I don't have slides. I do have a presentation, so I'm just going to talk to you. So, and as Berenice said at the end, if there are any questions, please don't hesitate to ask. I think our planning to reopen facilities has been quite an interesting piece of work, which has sort of been going on for the whole time that we've been in lockdown, which, I mean, I don't know how many of you run charities or community centres, but clearly once we got all of our services online, and we've got the majority of our services online, and we're contacting our clients remotely, there are always, of course, a number of clients, quite a lot of clients who struggle with that, and for reasons of feeling isolated or feel digitally excluded, whole variety of reasons. You know, we're very keen to try and open up our facilities sooner rather than later, so that people can start to have some face-to-face interaction. And also it's important for our staff. Everybody, as we know, is working remotely, and whilst we encourage that, it's very challenging for some people, and some people need to come in once again to see their colleagues, or are working in an environment that isn't conducive to home working. You'll recognise all of that. So on a practical level, what we did was to pull together what we've called a reopening task group, and that comprises myself and our finance and operations director, and then our wellbeing and HR managers, and representatives from our services. So it's our role to meet on a weekly basis to sort of do the planning, but also sort of carefully monitor the situation. And one of the things that we found throughout this process is it's really important to continually keep in touch with staff, particularly our frontline staff who are closest to our clients, to understand both their concerns, but also the demands of our clients as we go forward. So we've been consulting fairly regularly with people around what they would like to see in terms of reopening, but obviously working in conjunction with the government guidelines. I don't know about you, I think we found the government guidelines somewhat open to interpretation. So we've so there's taken quite a lot of work to think about what it means in our own particular setting. And we run a range of services. So we run social care, daycare, which means offering quite a lot of personal care to our clients, to classes for ESOL classes, so language classes in a classroom setting, and we offer one-to-one support to people in confidential support. And we also have a GP practice on site, which obviously has another set of questions and concerns and obligations. And we're also situated in a park, which we still need to look after. So there's a whole variety of sort of services and activities that we need to consider, that we've needed to consider as we go forward. But I think first and foremost, we've tried to marry the sensible advice, government advice about protecting our community, which is rather a vulnerable community, protecting our staff, and trying to offer some level of activity and support even during lockdown, and we're taking it quite slowly. Having said that, throughout the process we have been operating a food bank. So Bow Food Bank we're in partnership with, so we've opened up our premises, and because of lockdown we've been able to do that. We've been operating a food bank, and we've had around 300 odd people come every week. As you can imagine, the demand for that has gone up, and we've been able to do that in a very sort of careful way. It's run predominantly by volunteers, and so we've had hosts who have helped to maintain the sort of social distancing, but doing it in a way where it's not people can still speak to each other, and we offer coffee and tea so that there's a sort of a minimal level of social interaction, so it's not too bleak queuing up, and we encourage that in the park, but equally we're protecting people. So in terms of advice, I think there's for all organisations, particularly where you're offering services to clients, it's about retaining a sense of common sense, taking the advice, but trying to provide an environment where people can safely interact and access the services that they want. So, so where we've got to now is that we're offering as I say, we're offering the food bank once a week. We're offering one-to-one advice services but in quite a big open space, but that remains confidential. We have a meter and greeter that takes people to their appointment. It's done by appointment only. We are starting to introduce some group sessions, and we're doing risk assessment. So we risk assessed everything, all of the activities, all of the services that are likely to come back. We've also asked individual staff members who are coming back to go through a risk assessment around their own health, so that we're not putting them into an environment where they feel at risk or concerned. And that includes things like travelling on public transport. And we've also been lucky enough to access some training that's been put together by Tower Hamlets Public Health. So people have gone on the training course, so they understand about COVID and the impact of the infection, which we found is quite useful. So I think overall, there are probably three streams to the reopening. One is to keep an eye on our client and our community needs, and try and engage them as much as possible in those discussions. Keep an eye on our staff needs and our staff concerns, and consult with them about what, and ask them ideas, because the best ideas always come from the staff. The top-down approach rarely works. And the third stream is keeping an eye and adhering to government advice, and thinking about the safety of the community as we go forward, and also thinking about this being a sort of longer term, potentially a longer term situation. So, sorry, and there's one other thing, we've continued to say to people, if they are able to work from home, so a lot of our back office staff, our fundraisers, and our finance team, and our HR team, will all continue to work from home for the time being, and we are reviewing it on a monthly basis. I don't think I've got anything to add to that, Berenice, so I'll leave it there.
Thank you so much, Catherine. That's really helpful. And some people have been sharing as well how they've been kind of planning to reopen and things like that. So that's interesting. We can come back to that during question time if people have any questions. All right, so now Jess, I'll hand over to you to talk to us about also the kind of part about involving community members. We've gone through logistics of reopening the centre, and now I think it will be helpful to talk about community members, because that's kind of why we're here.
Thanks, Berenice. If you could go to the next slide, please. So yeah, today I'm just going to run through some background of the projects that I run, which is one of the many Bromley by Bow Centre projects that really encourages resident-led activity. Could you go to the next slide, please? And thank you. And then we're going to have a look at some member reflections. Some of the current participants have had opportunities to feedback about what worked well and what we could do differently, and then opportunities for new engagement and new visions and what's next. Next slide, please.
2484.
Thank you. So Communities Driving Change, we work across 3 areas of focus in the northeast of Tower Hamlets: Watts Grove, Burdett Estate and the Old Ford Road. And before COVID-19, we were running 15 resident-led activities, including walking, cycling, exercise groups, a children's confidence club after school, SEND carers, coffee mornings, and event organising teams. And we had 34 active volunteers with a network of over 550 residents who were engaged through participating in local groups, attending the regular activities, or helping or attending estate-based events. Next slide, please. So yeah, our approach is that we look to build people's confidence and capacity and improve individual health outcomes in order to, and all the while building connections to hopefully affect change. Next one, please. Okay, so we had an opportunity in our we have monthly resident meetings where we get together and discuss relevant things and updates from each of the areas. And we had one of these meetings last month where we felt like it was a good opportunity to kind of stop and reflect. So we, yeah, my team have done an awful lot of work in supporting residents to get online and use Zoom. So we had a Zoom online resident meeting where the team were also populating this thing called a jam board. That's what you're looking at now, where the question was presented: what has worked well in CDC during COVID-19? So we got some really good ideas from people about what we'd done that had been helpful and what they had valued about our work. Yeah, I don't know if that's come up quite small for you, but things like helping to stay connected. Actually, some people are saying getting more contact with the project, and also some kind of direct support needs that Communities Driving Change has enabled to happen. Can we go to the next slide, please? So we, in this meeting, we did a kind of stop, reflect, what's next approach. And then, so we were asking the current residents, what would you like to see more of from us? And as you can see, there's lots of great ideas. And our task now is to work together with the residents to action some of these things. Next one, please. Oh, so I think at first, with all of these kind of new constraints about social distancing and people having this fear of meeting outside, now residents are wanting to do more face-to-face activities, and that's fine for people that we've already engaged with and we know. But what about some people who aren't already in our network? We have actually found that safe, socially distant engagement is possible. In fact, today one of the teams is on one of the estates, speaking to people about what makes a healthy and happy childhood for children who live on this particular estate, making some beautiful bunting. So yeah, there is extra work, like I saw in the chat box, to do all of the risk assessments and make sure everything's in place to make this safe. But it is possible, and what we're also finding is that there's new interest from new faces, which is really exciting to see, actually. And yeah, next slide, please, Veronice. Yeah, I just wanted to mention the digital divide here as well, because while lots of residents do want to get back to face-to-face activities, there are some people, like I previously mentioned, who are more able to engage with us online. So here a challenge is, how are we kind of weighing things up to make sure that a return to face-to-face activity doesn't exclude the people who really were able to connect with us better through digital means. Next one, please. Finally, oops, sorry, it's a bit of a messy slide, but yeah, just to mention that it is an opportunity to create a new collective vision, because there have been massive shifts locally. For example, public realm changes lots of people have seen, whereas people might have thought it's always going to be that way, it's never going to change. Over a course of 3 months, we've seen so many things shift. So that can open up new conversations and new possibilities too. And people have got some clarity on what really matters to them, which we found is like connections and support and feeling like you belong to part of a community. I just wanted to bookend that with a comment about just caution about not over-promising things, because I think I think it's clear to us that we've got lots of challenges ahead of us, and we like, whilst we want people to dream big, I think we just got to be really careful about making promises here. Next slide, please. So what we've got on the cards coming up is, so we're supporting the community to build a vision and a plan for what's next and update what was going on. One point I would like to make is that quite a lot of people's needs haven't changed all that much as well. If people are interested in running activities or things, there's a lot of things that have remained consistent. Also, we're planning a community voting day in Old Ford Road, which is a method of participatory grant making where individual residents will be partnered up with local stakeholders to develop small projects. Also, we've got the launch of our community coaching circles. So during this time, residents have accessed some coaching training where they'll be able to peer coach each other with ideas for their community. Finally, we've got an outdoor screening of a filmmaking project coming up too. Next slide. I think that's me.
Awesome. Thank you so much. It's really interesting and very exciting about the outdoors screening. All right, so thank you so much. I've seen that people are sharing, so that's really great. Again, we can come back to that a bit later on. So thanks so much, Jess, for this presentation. It's really interesting. And now, Dan, so I'll hand over to you. So now we've talked about kind of the logistics of reopening safely our face-to-face services, how we involve the community to talk about these changes and how we engage with them. And then Dan will be talking about how we make sure that we've been learning from what's been done during this crisis, and how we make sure we kind of capturing those changes and making sure we learn from them and continuing forward. So Dan, I think you're on mute now. No. Oh, good. All right, I'll hand over to you now.
Thank you, Berenice. Yeah, Bromley by Bow's been, I think, like many organisations, engaged in a fairly deep learning process over these and reflective process over these past months, including the development or continuation of our community research programs, which are around understanding certainly what makes for a healthy and happy childhood and families. We've created a whole digital access point called Family Playrooms, for example, to support that as well. And Jess has described the work of communities driving change. I think in all of this, we have seen some very significant challenges to our community. As Jess said, indeed, we're working in East London, one of the areas of greatest challenge and deprivation in London, certainly. And many of those existing issues have been overlaid by further issues that the COVID situation has brought about, particularly around isolation and digital access, for example. But also some very, very real practical challenges around distribution of food, access to medication, those sorts of things, and of course, increasing levels of unemployment within our community. In terms of the learning, I think one of the really important things that we have just thought about a lot is about the power of community. And like in many parts of the country, probably across the whole country, very, very significant levels of increase of volunteering, for example, mutual aid groups, NHS responders. Our food bank is now feeding almost 400 households a week, and that has been significantly, that's 4 times more than it was before COVID. And it's the outpouring of support for the food bank from local people, both in terms of donations of food and volunteering on the days that the food bank runs, has been absolutely overwhelming. There's a concept that's being talked about now, which is called the 15-minute city, which is the fact that a large conurbation like London, you can turn it into hundreds of little cities, as it were, which of course are really akin to villages. And there's that wonderful phrase, of course, it takes a village to bring up a child, and maybe it takes a village to look after a village itself. So how we support people to make greater connections in their own communities, we think is really, really critical. Reducing social isolation, but more around creating the opportunity for people to come together, to do things together, and thereby support each other with their needs is really critical. Along with that localization agenda are thoughts around how do we reduce transport usage, how do we encourage people to walk more within communities, how do we create more opportunities for cycling and safer cycling opportunities, how do we create green local agendas is something that we're very interested in. How do we get children walking to school, for example? That sort of thing is really important. Another thing is around how do we create good jobs? We know that there's going to be a significant downturn in the economy over the next 6 to 12 months. And we're doing a lot of work around developing social enterprises. Our social enterprises at Bromley by Bow have already created something around 400 jobs in the past decade, and we're building on that. How do we create good jobs, meaningful jobs for local people? And within that, how do we really support young people as young people come into the labour market? It's very, very challenging for generations who come into the labour market in times of economic downturn. And we think that that's an area that we want to particularly focus on going forwards as well. Jess has talked about some of the work we've done around digital access, and we will definitely be continuing to do that. Digital access was an agenda long before COVID, of course, but the COVID situation has really highlighted the critical importance in terms of supporting people around equity, around digital access. And I guess this brings us to one of the sort of rounding up points, really, which is around how do we create good safety nets within our communities that support people both in times of need, but also support people to flourish as well. And it needs to be said that Bromley by Bow has always had a strong theme around the arts, around creativity, around communities coming together, around celebration, around food, around festival. And those sorts of things are, and people exploring how they express themselves and develop skills as well in those areas. And that remains critical for us as well. How do we celebrate community? And how do we create the safety net within communities that support people accessing their basic needs? Just to finish, we're involved with a number of programs around measurement. One is the taking forwards of our stretch outcomes, which is a set of community devised indicators that we developed with Public Health England, the Health Foundation and the Wellcome Trust in a 2-year community research program. And we're starting to apply those outcomes to our services, including to primary care as well, our clinical services. And these are community devised outcomes. The other is that we're working with a wider team called the Institute for Global Prosperity around something called a Prosperity Index. And over the next 10 years, we hope to be measuring a longitudinal study on the development and how prosperity shapes for East Londoners. And this is really the seeking to move away from the traditional measures of prosperity, such as GDP and so on, to, again, community devised understandings of what adds up to and what equates to a prosperous life for Londoners. And so we're very excited about these two programs around research and measurement, because we think these will help to inform not just ourselves, but much larger bodies such as the GLA, and the NHS and local authorities around what we need to be doing for communities to support communities going forwards and what is meaningful to those communities. Thank you, Berenice.
Sorry, I couldn't unmute myself for some reason. All right, thank you so much, Dan. That was really interesting, and I see some people are asking questions. I think the first question that would make sense to answer now, Dan, would be, what are the stretch outcomes? And you're mute now.
Yeah, thank you. The stretch outcomes. So we carried out a 2-year research program called Unleashing Healthy Communities, and the reports are on our website for everybody to access, and they also include the outcomes for you all to see. But we, as part of that 2-year research program, we engaged a group of local people as citizen scientists or community researchers to carry out research with thousands of local people around what made for a meaningful life and what made for a good life for local people. And the 6 stretch outcomes are around people's basic needs being met, which are essentially Maslow's hierarchy of needs of shelter, of income, of health and education, and food, and those sorts of outcomes. That's basic needs met. A very, very strong emphasis around connection. People wanting to feel connected to other people, but also being connected to their community and connected to and having access to resources within their community was very important as well. People wanted the opportunity and to be able to have developed their own skills and capabilities, which is very interesting because it gets one to think about moving away from this sort of transactional approach to services to something that's far more co-productive, which leads on to another one. People wanted the opportunity to contribute. People didn't want to be passive recipients of services. People wanted to be able to give back. And as I mentioned before, the volunteering under COVID has demonstrated that. The other thing that people said they wanted was to really develop their own feelings of sort of self-confidence and self-esteem as well. So these are the outcomes that we devised. This year, we're starting to test them within our services at Bromley by Bow. So we've got a year of testing and trialing. And then we hope by next summer to be able to then roll out these outcomes across all of our services at Bromley by Bow, and including within areas of primary care as well, primary care delivery in our health centres. So very, very exciting indeed.
Thanks, Dan. There were a lot of questions just about the coaching circles. So could you let us know a little bit more about that? I think people found it very interesting and they're quite keen to hear more about it.
Sure. So one of the ways that we've been working with people is through a kind of coaching like approach. So as community staff, community practitioners, we'll support individuals to kind of maybe work beyond their barriers and be able to identify their barriers through coaching. And last year we started working with Becky Seal from Coaching Communities, who has developed this program that 14 of our participants attended during lockdown. It was online on Zoom, and it involved 2 kind of main modules. One was about coactive coaching, so just understanding coaching principles, and then the second module was about how to facilitate a group online, and that meant that community members came away with the skills needed to kind of hold a group online, as well as learn how to support each other with issues that they're facing. So yeah, we're really excited that it's starting up in September. What also happened is that we were working with other local community practitioners. We had a couple of people who were also part of that course. So it was really interesting to be learning alongside community members. And yeah, they're also going to be part of these peer coaching community circles. If you're interested, get in touch with Becky. I'll put her email address in the chat box.
Thank you very much, Jeff. That does seem like really interesting. Someone is asking just about this. How did you address individuals not having the necessary digital resources?
Thanks. I mean, it's a really difficult question. I think we just found all of the means that we could to reach out to people, and we found that the majority of our current engaged participants did have access to perhaps a smartphone, but there were a few residents who either did and didn't know how to use it to access online video calling platforms, or they weren't confident in, or they didn't have these devices. So what we did was use kind of normal landline telephones to reach out to people, and we also found ways that people could use their landlines to call into Zoom calls. It's a bit more difficult, but also locally, we work in an area where with a strong partnership with Poplar Harker and other local organisations that have been kind of lending out people devices. So I think we haven't actually done that with any of our participants, but it was good to know that it was there if that was the issue. I want a device and I don't have a device.
Awesome, thank you very much. Okay, so moving on to other questions. Catherine, I can't see you anymore, but maybe you've switched off your camera. There's a question about, are there any COVID risk specific assessment templates that people could kind of use and obviously adapt to their own situation?
Yes, there are. Well, we've adapted. We adapted a staff risk assessment from one that was in use in the GP partnership. So, and we'd be happy to share that. So it allows the staff member to record any of their own health issues. I mean, obviously, in the context of sort of data protection and making sure that that information isn't shared beyond. And so they do their own risk assessment around their own health, and then there's a sort of RAG status, red, amber or green, and that could determine the sort of environment the individual might be placed into work. So a very good example of that is that if somebody has it has a sort of pre-existing condition, and it's possible that you wouldn't allow them to do face-to-face work during that period. So, but it's fairly self-explanatory, and we found that quite useful. And every single staff member who's coming back to work, some from furlough or some just coming in when they've been working from home, have been asked to do that. And we've got other. We've got other risk assessments for the actual service or the area that they're using, but we be very happy to share those if you find them useful.
Thanks. Yeah, I think maybe we can share that in the follow-up email as well as different kind of things we've been discussing today. Thank you. And then I think that's the question for both Jess and Catherine, actually. I mean, so we've been talking about doing things in the park and doing things outside at the moment as much as we can, but people have been mentioning, like, how do we deal with the weather? Obviously, we're in the UK, so there's quite a lot of rain and things like that. And also, if we have to if we go back to lockdown in autumn or winter, what's the plan? What can we do? I know that that's a difficult question, but I think it's interesting to think about.
Shall I start? I mean, if I could predict the weather. I know, but it's an excellent question. So I think, we use fairly simple devices. So we've got some gazebos that we can put up in the park, so to protect people and still maintain distance. I think the use of some of our larger spaces. So we're lucky enough to have a hall and a couple of other rooms which could allow the gathering of a few people. But you do have to. We obviously risk assess those and make sure we're sort of 1 metre apart, which is current guidance. So I think it's, but I think come the winter, it will make it more difficult. So, but as I say, within our open areas, we put up gazebos, which is what we do when it's very hot as well, to protect people from the sun. So that's one way of doing it. But I mean, Jess does a lot more outdoor activities like cycling. So she's probably got some interesting input into that.
Yeah, I guess I would say that it's something that even before COVID was a thing that we had to consider, and to have some flexibility in our kind of plans for outdoor activities. Yeah, I mean, lots of the activities that we do run and that are starting, the face-to-face activities that are starting up, some like the cycling group, sometimes they are rained off, but we are looking at like how could we avoid having them rained off? Do people have suitable all-weather clothing? I think for the idea of having more static outdoor meetings, it does pose a really good question. I feel that we need to be using this time to make it as many of our residents digitally adept as possible for what if another lockdown does happen, so they're able to connect via Zoom and other digital platforms too.
Thank you, that's great. I think just coming back quickly, Dan, to the stretch outcomes. So someone was asking about, could we hear a little bit more about the approach on testing the stretch outcomes?
Yes, certainly. And this is very live as we speak, really. We just started this work. We're doing scoping work at the moment. So Bromley by Bow is a very complex organisation. It delivers something like 45 different funded projects across a whole range of different things, from welfare advice and community development projects, such as the one that Jess has been talking about, to employability programs, adult learning, lots of community activity groups as well, welfare benefits advice, and so on. So we spent the last 3 months assessing what those projects currently ask their clients, and lo and behold, they ask them something over 800 different types of questions at the moment, many of those prompted by their funders. So we're doing a whole process of trying to streamline that and create some basic questions that all projects will ask. We are taking the 6 stretch outcomes and thinking about the fact that not all of the 6 stretch outcomes get applied to all of the projects. So the projects will select the outcomes that are most appropriate to what that project is, and that we will measure the achievement of the outcomes for the different projects, but between them that will create a very rich composite picture across those 45 different projects. We're assessing what kind of measurement tool that we might use, and there are a whole range of different options that we're thinking about here, whether we use questionnaires, whether we use some validated tools, or even adapt some validated tools. We've been talking to the Wellbeing Star organisation, potentially about creating our own Bromley by Bow Outcome Star, for example. So we will be testing both the questions that we ask clients and the tools that we use to ask those clients with in what's called a 100-day challenge. And that will start mid-autumn and run to early next year, which will allow us to assess the questions and to assess the different tools that we use. And we're also aware that evaluation needs to be proportionate, and one of the critical things is it needs to not interfere with the rapport building that practitioners are trying to do with their clients. And so it needs to be as light touch as possible. It needs to generate sufficient data, but not an overwhelming volume of data as well. So getting that balance right is also really important. So that will take us through until the spring. Then we will undergo a process of refinement. Bromley by Bow's annual year, if you like, starts on the 1st of July, curiously. So we hope to have everything in order by the 1st of July next year in order to be able to then apply the outcomes framework across all of our services as from July next year. We were also aware that, you know, the next year will again be a testing year, and we're quite aware that this will be a process of development and refinement over a period of years. But the intention is to create, you know, whenever you think of evaluation, I guess there are two things to think about. One is proving and the other is improving. So obviously part of the function of evaluation is to try and prove the change that services or interventions create and develop. Of course, that's very difficult in social spheres. Attribution is often nigh on impossible. Contribution is probably something that one can aspire more to, that a service has contributed to an outcome. But the other thing is around improving. So for us, it's really important to think about this whole process as involving both our clients and our practitioners, because whilst, you know, we're very interested in what the results are, we're also very interested in what the process teaches us about our services and about the way we work with people, and how that then informs service improvement and ongoing development of the Bromley by Bow model. So it's going to be a very, very participatory process that will involve our clients and our patients and our practitioners. And we think that the learning, the ongoing learning, is absolutely one of the fundamental outcomes that we hope to achieve through this process of evaluation, and how it continues to inform, as I say, our model and our services, but then how we can share that informing with other parties, such as our local authority, for example, the Greater London Authority at a London scale, NHS England, and so on and so forth, so that this can start to shape people's thinking. We think it's really interesting that we are measuring outcomes that have been devised by our local community, that are meaningful to our local citizens. So often services measure outcomes that are of interest to the service without ever stopping and asking themselves what might be of interest to the clients, if you like, or hopefully the co-producers of that service.
Awesome, thank you so much, Dan. There are a few other questions, but I think one that's a little bit more general and interesting and kind of, you know, good for the three of you is, are there any advice, is there any advice for a social prescriber who just started this year to start reconnecting with the community? Any tips, anything that comes to mind now to kind of, for people who just started their role this year?
I think that depends where you are based as a social prescriber, but essentially you need to start connecting to third sector, voluntary sector organisations in your community. You need to start to build up a directory of services and access other people's directories of services. Your local authority or your local CVS may well already have a really strong directory of services within your community. And then I would suggest you start getting on the telephone. Emails are fine, but actually having phone calls with some really strategic third sector organisations in your area who will be able to then lead you to other organisations, and building personal relationships between yourself and the staff of key third sector organisations will be absolutely critical. So I would suggest go for the telephone, go for speaking to people, and take advantage of every local networking opportunity you can find to get yourself known to other people within your community.
Yeah, I might just say as well, the networking breakfasts are good if you're lucky to have one of those in your area. Yeah.
Or if you don't think about organising one, invite half a dozen or a dozen local community organisations to have a virtual networking breakfast, and you can be the host of it.
Just jump in. Can I just jump in? Sorry, it's George from Brighton Hove. just sent you a direct message with my email address on, so we can have a chat, because we're neighbouring, and so I might be able to kind of have a bit more of a chat with you about kind of what might be helpful.
Oh, absolutely, yeah. Be delighted to do that, yeah.
That was
Catherine,
the person that asked the question, but yes, thank you, just in case it's helpful. Thanks, Dan.
thanks. Catherine, do you have any tips for, I know you work closely with the social prescribing team, so
what's being suggested is entirely sensible. It is about just there's personal connections. From our point of view, it might, depending on where you're based, we might know someone. I think Dan knows every single social prescriber in the country. That might be an exaggeration, but we know an awful lot of them. So if there's, we might be able to put you in contact with people that can help. But I think, yeah, you'll find there's an extraordinary number of networks in most areas, and certainly the CVS is a good place to start. But if you talk to others, yeah, I think that'll be really helpful. I haven't got much more to add to that.
sounds great. Thank you very much. And so I know there are other questions in the chat box, but unfortunately we don't have time to kind of cover them all. What I'm going to do is I'll take the questions and kind of put them to our panelists, and they can answer them in written, and we can have a little kind of summary as follow-up. I'll also kind of take some of the, I saw there were some case studies from other people in the chat, and some resources and things like that. So we'll publish all of that, just so that you can kind of, if you've missed anything, you can see that. We'll send it along with the recording, the slides, in a couple of days. So you may have noticed I've put the feedback kind of survey up, so if you could please answer this, that would be really helpful for us to understand how useful those webinars are, and if we need to change anything or any topics you think that would be helpful in the future, that would be really good. We have a workshop on social prescribing coming up in September, so that's the next event that's coming up. We'll be talking about how to engage other kind of stakeholders. So it's not just about social prescribers, it's also about kind of engaging GPs and other organizations and things like that. So we'll be talking about that in a workshop early September. And yeah, we have plenty of other events coming up, and we'll be sending you all the details via email. You can check out our website, and everything's on there. So I hope you enjoyed this, and I think we'll conclude on this. So just before you go, don't forget to fill in the survey, and I think yeah, we'll be seeing you hopefully on our next webinar. And thank you very much to Jess, Dan, and Catherine, obviously.
And Berenice, just to ask the question, do we have the details of the social prescribing link worker who asked the question about connecting with community?
Yes, probably. Somewhere in there. We can,
okay.
I mean, please do get in touch if you need anything. I'll put the insights email in the chat box, so that if someone wants to get in touch, they can just let us know. Is that all right? All right, cool. Thank you very much, everyone.